All right, so this is our ergonomics assessment. So we're going to walk you through exactly how I'm sitting in this operator chair, and you guys are going to demonstrate this for your instructors and verbally recite for them everything that's on your assessment. So let's start at the beginning. What we want to do when we sit on a chair, it sounds silly, but it'll actually be extremely important for you guys throughout your career. What you want to do is you want to evenly distribute your weight on a chair, which means I don't want to roll up on one hip or roll up on the other when I'm working on a patient. I want my hips evenly distributed. If you do that roll up, if you want to try that in clinic today, what you're going to notice is that the muscles in your lower back and your hips are going to strain when you do that, which can lead to a lot of injury for your lower back. You want your hips straight, and you actually want your hips, which are right here for me, a little higher than your knee. So back in the day, we actually used to sit like this, about 90-degree angle, right, between the hip to the knee, but they found out that was actually breaking circulation. So what we want to do is lift up our operator chair slightly so that my hip and my knee are offset from one another. You don't want to go too high, you don't want to go too low. You always want to sit with a straight back. You don't want to hunch over like this, you'll feel your lower back strain. And you don't want to arch the back because you're going to feel the middle back muscles strain. So you just want to be sitting up straight. A lot of chairs have wonderful, what they call lumbar supports, where you can actually take the back of this chair and push it into your lumbar so it forces your back straight. You always want to keep your neck and your head in line, which means when I'm working on a patient, I don't do this as I'm trying to see different areas of the mouth. The head always has to be straight, and you're looking down at your patient about 15 to 19 inches, and you will use your mirror anytime you can't see teeth. So instead of doing this, I'm going to sit up straight, and I'm going to utilize my mirror for indirect vision so I don't change my body position. If you do need to lean forward to visualize an area, you always, let me turn to the side here. You always lean forward from the hips. You don't squinch the back to try to get closer to your patient. You sit up straight, you lean slightly forward from the hips, and straight back the second that you can. Your feet are always flat on the floor. We don't clean teeth or work on patients like this, or like this, or like this. Both feet would be in line with your knees and completely flat on the floor at all times. When you are working with a patient, we want to keep our forearms straight. You want to keep your elbows close to the body. Now you can move your elbows up about 10, 20, 30 degrees without getting too much strain in the lower back. I know Jill Neal tells us a 0 to 20 degree angulation and movement with the elbows are fine without causing an ergonomic issue. When you come up to 90 degrees, now you're going to feel strain in the neck and in your shoulders, and that can lead to many muscular and neuromuscular injuries. So our elbows shouldn't go up more than about 20, 30 degrees when we're working on a patient. The wrist is always going to be straight. This is a very important concept for you guys to grasp. If you are having difficulty working on your patient or getting in the right chair position, the last thing and the thing you never do is you never compromise your wrist. You don't want your wrist to bend inward or bend outward when you're working on a patient. So if my wrist has to bend because I'm trying to see something in the mouth, it means I am sitting in the wrong position. I need to move my clock position so that my wrist can be straight. You never compromise the wrist. The wrist is not the thing that's wrong. You are wrong. You're sitting in the wrong clock position. The other thing that might be wrong is your patient positioning. Many times throughout the mouth, I'm going to want my patient to turn away from me or turn towards me. And that is the language you want to use. You don't want to say left or right, mainly because you will probably be reversing your left and right from your perspective to the patient perspective. So if you always tell them, turn towards me a little bit, turn away from me, the patient knows where to go and where you need them. So let's talk about basic clock positioning. And again, I'm a right-handed clinician, so I'm going to demonstrate from the right, and I will also demonstrate from the left for our left-handed clinicians. All right, so whether you're right or left-handed, the main thing you want to make sure of before you begin doing anything is that this bracket tray is within easy reach for you as the clinician. So you don't want your bracket tray way up here, because look what happens to me. I'm working on a patient, and I have to reach way up here and come way back down to get an instrument. So every time I lift up that arm, I'm actually straining the muscles in my neck. So I want my bracket tray down low, probably at the position of your waist, and within easy reach. So I can turn, get my instrument, turn back to my patient, continue what I'm doing. And again, you will see that I don't twist my torso to do that, because again, straining the back, straining the neck. I move my body to put my instrument down and move back. The other thing we need to talk about too is patient positioning. So this is my patient's mouth. You are always going to determine how high your operator chair needs to be or how low based on the patient's mouth to your body. So ideally what we want is this patient's mouth to be in line, probably just above my belly button. Some people say your waist. So I want this mouth is a little high for me. I need that mouth down here. Another way to determine that is if you turn to the side of your patient and you put your elbows at 90 degrees, that patient's mouth should be at the line of my elbow right here. So you can see that this mouth is probably about a good 2 inches higher than my elbow. So what I'm going to do is I'm going to move my patient chair down so that this patient's mouth is now in line with my elbow. If I turn to the patient, their mouth is just at the level of my belly button, because if the patient's mouth gets too high, I will look like this cleaning teeth. If they get too low, I'll be down here without good control, and the patient also becomes more than 15 to 19 to 22 inches from my line of sight. So this is the correct patient positioning for my height. So let's talk about clock positions. What we're going to want to do is first get our light, and if I'm on a maxillary arch, I'll turn this on for a moment and then I'll turn it off. I'm going to turn my light on. If I'm on a maxillary arch, my light will be at about a 60-degree angle, illuminating the maxillary arch. If I am trying to work on the mandibular teeth, my light will come up and over at a 90-degree angle. You guys see the difference? 90-degree directly above the patient versus a 60-degree angle. All right, so I'm going to turn this off because I know it's hard in the video when we have the light on. All right, clock positions. We're going to teach you two basic sets of rules for clock positions. Let's start with anterior teeth. If you are a right-handed clinician, you will have a lot of range of clock positions to choose from by working on anterior teeth. You can come all the way up to what we call 12 o'clock, so directly above the patient, and we can work on front teeth from this positioning. Your other choices are 11, 10, 9, or 8. And all are acceptable for anterior teeth. You'll find that you will use probably your 8 and 9 o'clock predominantly for surfaces towards you. And you will use more of your 11 to 12 o'clock for your surfaces away. Left-handed clinicians, I'm going to zoom by you here. Okay, so you guys are just the opposite on the left side of the chair. Your options are 4 o'clock, 3 o'clock. I know my back's going to go to you, just bear with me. 2 o'clock, 1 o'clock, and 12 o'clock. You just take what we're doing on the right side and you switch it to the left, to be honest with you. Okay, now when you're doing posterior teeth, this is where your range of clock positions changes. And you will very infrequently, minus maybe 2 areas of posterior teeth, ever use 8 o'clock and 12 o'clock. Those clock positions, or for my left-handers, 4 o'clock and 12 o'clock, those clock positions tend to dissipate when you are working on back teeth. There's a very simple reason why. Because your patient has cheeks and a face. And most of the time you can't see the teeth that you need to see when you're sitting at 8 and 4 and 12 o'clock. So your general range of clock positions for posterior teeth for right-handed clinicians will be 9 o'clock, 10 o'clock, and 11. Left-handed clinicians, 3 o'clock, which is your right-hander's 9, 2 o'clock, which is the right-hander's 10, and 1 o'clock, which is equivalent to the right-hander's 11 o'clock. So for anterior teeth, we can range from 8 and 4 up to 12. For posterior teeth, 9 and 3 up to 11 and 1. And when we start using instruments more, you guys are really going to understand these principles. But for right now, for learning ergonomics, these are the things that you will demonstrate to your instructors in lab. And you can always refer to your Jill Neild book for further explanation and clarification of these principles.